Welcome to the Feel Better, Live Better podcast. Our goal is to provide you insightful conversations about all things health and wellness. We dive into the stories, science, strategies that help you optimize your well-being, physically, mental, and emotional health. Each episode features engaging discussions with health experts, real-life success stories, and practical advice to empower you on your wellness journey. Whether we're breaking down the latest medical advancements, exploring holistic health solutions, or chatting about everyday habits that make a difference, our goal is simple: to help you feel better and live better. Tune in for inspiring narratives, expert consultations, candid conversations that bring health to life, one talk at a time.
If you enjoy our podcast, please like and subscribe and consider becoming a digital subscriber to the Albuquerque Journal to help us bring you more content like this. You can find this episode and all of our podcasts on the Albuquerque Journal website, abqjournal.com, as well as YouTube, iTunes, and Spotify. See the show notes for a discount code on a digital subscription. Thank you for supporting the Albuquerque Journal, New Mexico's leading news.
Welcome back to the Feel Better, Live Better podcast. I'm Kristi Fury, founder of Beyond Health, and today we're diving into a topic more families are becoming curious about: private pay in concierge pediatric care. Let's get into it.
Beyond Health is dedicated to helping patients achieve a life of health. Our passion at Beyond Health is transforming your health so you can live the very best life. Beyond Health can be your partner in your journey to optimal health.
Welcome, Kimberly Hart. You are a pediatric nurse practitioner and just recently opened up a private pediatric clinic, Heart and Mind Pediatrics. So thank you for joining me. And why don't you tell me a little bit about your journey of kind of how you got to this today, and then we'll also expand a little bit on your clinic.
Okay. Thank you for having me. This is a huge compliment. Just a pleasure to be around and to just have conversations about all the cool offerings that are coming up, new businesses in Albuquerque. Thank you. Thank you.
You're welcome.
So Heart and Mind Pediatrics is the first ever primary care for pediatric practices. That's a collaborative approach. And we had this idea because when you're in primary care in pediatrics, you really start to understand the importance that children need more. They're not segmented. They have so much more emotional and mental health awareness within themselves. I think parents these days have more of an understanding of the emotional side of our children. Yeah, exactly. And so we, our practitioners in primary care, we just realized nobody addresses both aspects in that holistic collaborative approach. So I had this idea that why shouldn't we open a primary care office that incorporates mental health services? So psychiatry, social work and counseling. Should we look at other, behavioral services? Yep. And so thus the idea was born. For heart, your body, and mind, your emotional side.
Very good.
Yeah, it was very cool. The idea came about, over time. Yep. My background is in emergency medicine. And so when you see the whole family approach. Yeah. It's really important to be how can we help beyond this? And to, raise healthier families. Yeah.
Well, what I'm so excited for you is I know I was one of the very first Beyond Health in 2018 introducing a concierge private pay program, right? Which I know in other parts of the country, it's kind of an acceptable, but in 2018, it was a rather new concept. And I can just tell you, the patients get more out of me being a part of our program as far as, paying a monthly fee, and they see the value in it. And so I'm so excited for you that you're one of the first in Albuquerque to do this for the pediatric population. And to your point is, I know we both have kids. As far as the kids are just complicated, I think, and not that they're complicated human beings, but just society has added complication, right? Food, the stress, anxiety, you name it, just everything that you talked about. So I'm just I really am so happy and proud that you can be a trailblazer for the pediatric population here in Albuquerque. And so moving into it, like, how are you talking to parents? Because I know you already have a clinic, but when you're talking to them about the benefit of, paying for a monthly program versus just paying, for a visit with insurance, what is your guys' approach at the clinic?
None of it could have been possible without trailblazers like yourself. I mean, you opening the door where I think adults have had the opportunity to see what Concierge can give them. And I think the most important thing it gives them is time. And time equals better care.
Correct.
Like, I just think it over and over again. And so then you look at, we're not doing that with pediatrics. And so I think it's what we're lacking in healthcare. I always have this homage, like, I think it was Archimedes who said, like, if you give me a lever and a fulcrum long enough, I'll move the earth. And I really believe children are the lever and we are the fulcrum. Like, if we change their health this age, we will change their health for then forever. And that could change our healthcare system. Like, that's really how powerful I think it is. So in having conversations with my families, it's, health insurance doesn't give us that benefit. We don't have time because in order for the lights to stay on, your provider to have a car, to pay rent, like we can't do the self-service or the self-schedule, the fee-for-service model doesn't work anymore. So trying to communicate with families, like what it gives us is time with you. And what time gives us is the ability to just pause and listen, to pay a little bit more attention to, well, is this symptom a part of a bigger picture? Let's look at the holistic approach of how your gut integrates with your mind, or how chronic ear infections translates to speech, and having time with families to help them understand health processes, help them to kind of understand that, like, they've got this. A lot of pediatric primary care is like reassuring parents, like, you're doing a good job. And I always say, like, parenting's only hard if you want to be good at it. Like, if you don't want to be good at it, parenting isn't that hard.
It's a true point.
It's so true. So I think, like, I'm trying, we can only do this because of what you've already shown parents. Like, in the adult world, this is possible, and this is what I get from it. And that's why people love what you do, and people love the concierge model. And now we just have to translate that to, like, we got to get it earlier, and we got to start a little earlier. And so I try to capitalize on that.
So are most of your pediatric, are the parents already in a concierge program? Like, have you been asking them? I mean, I'm just curious.
Absolutely.
Most of them are already in
some sort of
concierge program. So I was just curious on that.
I think that it's probably 50-50.
Okay.
We have a lot of families who, have brought it, again, this is kind of what sparked the idea of, like, should we be doing a concierge packages? But, families have asked, like, have you thought about it? Like, I would love to just have some more time. I can message my provider. I can get in same day visits. Like, and so once you experience the care in healthcare, you don't want to go back. And that is what I think you give the community, and that's what we're hoping to catalyze or capitalize on. Set fire to.
And so how is there a certain, like, pediatric population that you feel the concierge model works for? And I guess what I'm asking is, like, say a very healthy kid, or, toddler that just needs their well childs, and every once in a while they might get sick. Or do you feel like it's actually a better model for a kid that has a lot of chronic illnesses?
It's an awesome question. And we, at Heart and Mind, we've decided to offer 2 programs to capitalize on those exact 2 patients. And, I think we're all kind of experiencing the the exploding costs of our health insurance themselves. And so I think some families are stuck in this place of like, I don't know how, like, insurance costs are outrageous, so my premiums are high. So can we offer an alternative to, something that's a little bit more affordable where you can start to see, you can do like health savings accounts where you can say like, hey, it's a pretty nominal monthly fee, but I can always get in. I can message my providers. I'm going to get access to care more routinely for my kid who's not always sick. But I need routine care. And when they are sick, I don't want to have to wait 3 weeks for my primary care to see a rash. And so more like more affordable packages. I don't want to say affordable, but kind of baseline entry level packages that are very affordable.
Well, and I think it's affordable. And I'm sorry to. As far as time, I mean, I think for so many parents, our greatest commodity is time, right? Like, I think just how I arrange my life, it's, I put a time to it before a dollar amount, right?
Yes.
And I just, my daughter's 17, so thankfully I'm kind of out of those sick years. But, I mean, what I would have given when I was, busy building up Beyond Health and I had a child at home sick, if I had a concierge service that I could just call for her when she was sick. I think it would have been priceless.
Yeah, and a lot of times, especially like new moms, out the gate, you just don't know. No. Like my kid just, has a fever. Should I worry at 100 or am I worried at 102? And navigating that route, that fear, and then they start to ruminate, and then you think, oh, I should go to the ER or I should go to urgent care. Oh my gosh, that's going to be so much time. Oh my God, so just navigating the fears of like, no, on my concierge package, I could just message. I have access to my primary, and that's what matters is like, yes, you can come in. Let's see you. Let's easier access. But you're very privileged and lucky, as we all are, when you have some kiddos who don't have chronic problems. But there are families who are managing chronic problems, and those range from anxiety and ADHD and, to very severe things like chronic, asthma and diabetes. And so those kiddos need
a lot more touch points.
They do. Yeah. And like when they have something, and those parents, they're just so on point. And so oftentimes, they're their best nurses, I say, like you are with your patient all the time. And so sometimes, those families, again, the gift of time is like, no, I know my kid. When my kid gets this, when they get sick, their asthma flares up, we need this medication. And then they can't get it because they don't have access to a provider who knows them.
Who knows it.
And so I think that, both spectrums of children that you're managing, I think it's a great option because, again, back to, you're exactly right, time matters.
Are you going to organize your programs like, so say are you going to see your patients like every 4 months? Or are you controlling any of that? I guess, are you like saying, okay, we want to see you every 3 or 4 months, or no, you're good, you can just come in for your well child? I mean, I'm just kind of curious of how, if you want to dive in a little bit deeper, just so our viewers understand like your programs.
Yeah. So, no, each package kind of offers, we have 2 packages, and each of them offers that alternative schedule. So we'll go down a chronic picture. We'll just make up my pretend child. My pretend child has ADHD, and my pretend child's on a stimulant medication. If you have ever managed attention deficit, you know that stimulant medications, you're on a very rigid, you have to check in monthly or at least every 3 months, because when your provider doesn't know and you've got to manage a lot of things. The gift of a concierge package is that your provider gets the time to spend with you to then navigate that with you. And then you can really say, man, Kristi, you really manage these medications with your child really well. I think that we're okay. I will call you we can call, we can touch base, and then we can see you in 6 months. So it gives the gift of alternative schedule guidelines where normally traditional insurance dictates what a provider can do. But you need to be seen. You know, if we're studying you on an antidepressant, well, then we need to see you more often. But the gift of time is navigating when we get to see you. How does that look? Spending a little bit more time can say at the front of the visit can save us on the backside, right? So we don't have to follow you as frequently unless we need to. But I think that's what the packages and Concierge gives you. And I feel like you probably feel this way too, but you get to know your patients better. And you really know what patients can handle, what they can't handle. You start to really hone in on, man, this family just needs a little bit more support through this, or you get to know the family unit of like, man, I'm really sorry that you had a death in the family last year, and I know that's taxing and how that translates. And you don't get that when you have 10 minutes with your patient. Like you just got to get them in and out.
You just got to get them in and out.
Yeah.
Just one, since I've been out of the insurance world for a while, I'm just curious because I think, is pediatric, is it considered a specialty copay? Like when a parent comes, or is it just a regular?
Just a regular.
Okay,
pediatric primary care.
Okay. I was just curious because you know, I think that's so many parents and just patients in general, you know, I mean, there's your regular copays and then your specialty. So I was just curious of how the pediatric is. Well, because that alone is cost saving.
Yes.
If you're having to pay the copay for a specialty. And then, you know, I think that's, you know, what's awesome about how you're designing your clinic setting as far as with Heart and Mind Pediatrics is, I think they're actually going to end up saving money because you're having psychiatric services there. Because that's a specialty.
Correct.
So
exactly.
You know, I think that's something that, you know, parents could look at of like, well, I don't have to pay. I mean, I don't know what the average specialty copay is anymore, but
anywhere from $35 to $75.
So okay, you know, especially if they're, you know, going to your psychiatrist there, because you have what other specialties do you have?
So psychiatry, so mental health nurse practitioner, and then social worker is coming on board in the next couple months.
Okay.
Yeah. So social work, the difference between psychiatry and social workers.
Okay, yeah, please.
Yeah. Both of them work on our minds, right? Heart and mind. But psychiatry really does med management and a little bit of counseling. But unfortunately, they can't do a lot of counseling. One, that's not always their wheelhouse, but two, insurance doesn't let them do more therapy and counseling services. They're really restricted with time. So they really get to focus on your medication that they're managing, whether that's antidepressants, anti-anxieties, ADHD meds, whatever. Social workers, licensed social workers, get to explore the counseling world. So they get to do more therapy. So come in once a week, we're going to talk. We play, we stretch, you know, whatever that therapy looks like for that child, which the unique part about pediatrics is that counseling or doing therapeutic services for a child at 8 with ADHD looks very different than 18.
Correct.
You know, and so having both specialties on board allows us the flexibility to navigate which one you need. Oh, you're stable on your medications. You don't need $75 copays every month. Hey, you are counseling, and counseling services these days, you know, it's years wait. You can't.
Especially for the pediatric. I mean, the very few. So at Beyond Health, like, yes, we see, you know, so my programs, we do offer a family program, but kind of my rule is you still have to have a pediatrician on board. I'm happy to see you for basically urgent care stuff so that they don't have to. But I mean, I'm so excited that we've connected and are collaborating because I'm going to send all of my pediatric to you, you know, and again, like I'll keep the family programs, but those families, just like to your point, because, you know, pediatric has never been my specialty, right? I've been in the ER, I've done family, all that other stuff, hospital, as a hospitalist, but I mean, I've learned just a few things from you today as far as really what it takes from a provider perspective to have a kid successfully kind of accomplish those goals, right? Those milestones from a social, physical, mental, all aspects of it. And like I said, like I was always fine doing those urgent care visits for my families, but I'm really going to encourage them, the ones that, want to check in with me more often with their, I think of, I see teenagers, right? And I don't mind. I can, a lot of the kids I connect with, I have no problem seeing them. But to be fully transparent, I'm probably not their best person that they could be seeing. They'd probably be better fitted going to your clinic to have those touch points that, again, are just, it's not my world.
Yes.
Yeah.
Well, I feel the exact same way about adults.
Yeah.
But somehow diseese processes change on 18 years and one day.
Yeah.
Sorry, you have to go to an adult provider now.
Yeah.
We feel the exact same way. And so that's why our specialty is just pediatrics. That's why we send so many adults. Like I'm hoping that in this collaboration and this new outtake on what healthcare should be, when you get into a space where you're like, this is concierge medicine, this is access, this is what healthcare should look like, and then they want to maintain it forever.
Yeah.
That's what's ideal.
Yeah.
Yeah.
I mean, I think we both have the goal of, kind of my tagline that is just to help people live health.
Yeah, it's a great tagline.
That's my, because, people always will ask me, what is Beyond Health? And, I was like, well, if you want me to just put it simple, we're about helping you and giving you the ability to live health. I mean, really, that's what we try to accomplish at Beyond Health. Sometimes we succeed, sometimes we don't. Sometimes it's not the right partnership.
Yeah.
And I think that's something you'll discover as you go into this, concierge private practice model. You're not always going to be the right fit for every family, and that's okay.
Yeah, absolutely.
And I think just having resources to, send them somewhere else.
Yes.
So are there any, like a certain personality type of parents who would really thrive in your model? Like if you could give me that ideal avatar, what is that patient? What is that family?
I think the ideal candidate for, should I get into concierge or not? It's really the families who want to give their child like that holistic approach. Because we took our psychiatry on board when we started to launch this, the goal that we saw was like, wouldn't it be amazing if I could go in for my wellness check every year? And yes, we do vital signs, and yes, they check my ears, and they do all those things. And then the provider was like, hey, and now come over here because this provider is just going to check in on your mental health. And wouldn't it be great to just kind of unload, like, yeah, Kim, what's going on? I don't know. I'm really stressed out. I got a new job. We're opening a new clinic. And having someone who can navigate that, maybe give some feedback like, man, it's your senior year in high school. Sounds like you're under some anxiety. Here's some tools. If it gets worse, come back and see me. But I think that you're doing a really good job managing it or catching it and saying like, man, I didn't know that happened to you. Why don't you come back in a couple weeks, try these things, and then come back? We'll talk about how to get you through finals. We'll talk about how to apply, handle your stress as you're trying to apply for college or deciding you don't want to go to college or, whatever that adolescent picture looks like. But we do not have a healthcare system that wants to collaborate on both. It's very distinctively different. It's very like, and you only get to see a mental health provider if you're having mental health problems. But
who's
don't we
not
all?
having
Exactly.
who's not having mental health problems? I mean, come on.
I mean, they're not an orthopedist. Of course, if I hurt my knee, I'm going to go see a doctor. But mental health is ingrained in every single thing we do, and so we wanted this model of this annual wellness check-in that's just on your emotional and mental well-being. And so I think a lot of people want that. And so when you're looking at your child and you're thinking, I just want to know you're okay. And especially in this time, and like, what a time to exist. There's so many, news outlets that let children know exactly what's happening in the world, right?
Yeah.
Like, that's stressful.
Yeah.
And so for a family or a parent who's like, I want to be more holistic. I want someone to check in. I want to also be able to, have the flexibility of home visits, because that's an option in our programs, back to the time of, I want healthcare to kind of fit into my life, and I want to live healthy.
Yeah.
That's really the ideal candidate.
Yeah.
Is the person who gets, how important health is, and who wants to do it in a more holistic, collaborative approach.
Well, and I think, and maybe you know this statistic, I guess I'm asking it. Do you know, like, this Concierge Pediatric Services, have there been long-term studies done as far as what it computes to as far as better health for them in their 20s and 30s?
I mean, not direct studies of like Concierge.
Yeah.
But we 100% know that, like, your health, and we'll just do one measurement, like your BMI.
Okay.
When we are measuring BMI in 4 and 5-year-olds, we absolutely know your risk factors for later health.
Yeah.
We know ACEs, it's an acronym for Adverse Childhood Events.
Okay.
We know that an example of that would be a parent is incarcerated, or abuse in the home, or a parent missing in the home, being raised by grandparents, or, those are just examples. Homelessness, chronic poverty. Yeah. We know that if you have an ACE in childhood, high risk of chronic health problems. And that's likely, and, one of the contributions is like detection. Are we asking? And how do you ask that when you have 15 minutes with your patient? And some people are embarrassed to say that, but I think the benefit of having concierge models is that it'll give families the opportunity to have time with someone who will work with the kiddo over time. Yeah. It like you have said, you're such a leader in this, but it is a health package. Like it's a program that you're signing in. It's not just you've got to complete the program to really see the success.
And I think that's like our mind shift at Beyond Health that I'm really working on, is that shift. So I introduced in 2018 my packages as membership, right? But you have a membership to the gym, right?
Yeah.
Versus I'm really 2026 rolling out some very exciting, cool, but I'm focusing on programs, right? Yeah. Because that's what it is. It's a program to help you live health, right?
Yes.
It's you have a membership to your gym. You have a membership to
Netflix.
Yes, thank you.
Yes.
Yeah, whatever. You don't you don't have a membership to health.
No.
Right? It's a program.
Yes.
Okay. So one thing that I would like to kind of finish it up, as far as if you could maybe clear up, what is the common confusion or misconception since you've kind of because are you still offering insurance?
We still are offering insurance. We're such a high Medicaid state. That we still want to offer services to, to families who need them. But the hopes of like really trying to educate people on like, hey, this is what your insurance allows me to do. But there's this whole other thing, like this whole other world of caring that we could get into. This is how cool it could be. Yeah.
So what is that misconception or that you would like to clear up, like to make sure parents understand the value and how blessed we are to have something like this in Albuquerque for the pediatric population?
I think the biggest misconception is that I think change is scary. And so it's something new. Yeah. And so, families are fearful that they're getting bamboozled. And, again, we pay a lot of money into insurance premiums, and I don't think parents quite understand that you're paying in, you're not getting anything out of it.
Especially, I just never thought. What you've really said some valuable points as far as yes, I think there's actually the adults get more out of the insurance than the pediatric population, and it should be the exact opposite, because these kids are going to be our adults and invest. Just like what you were saying.
If
earlier.
we can control their health, or control's the wrong word, but if we can partner in their health and help them understand, in your words, like live health, we could eradicate chronic disease for older kids or in adults to some extent. But, it just, so having parents understand the importance of the holistic approach and educating on, we are so confined by what insurance allows us to do, that if you really explore the, greener pasture, you'll start to see what living health looks like. You're exactly right. And so navigating that with them, that this is, it's supersized. It's healthcare supersized. Pay the extra bit.
So what's the first step they should take? Give me your web, how, if a viewer or listeners wants to take action, what do they need to do?
Do it. That's what I tell them. You want to take action, you just got to do it. That's what I tell my kids. You want this, you have to do it. Super easy on our end. Go to our website, heartandmind.org. You can see our services, our packages. You can book an appointment with us. Come in and we'll gladly talk about what it looks like. Of course, all of our information is also on our social media platforms at Heart and Mind, Facebook, Instagram, TikTok.
All that.
All the things.
Yeah.
I know. Isn't that silly?
It's the joys of being a business owner. And now you have to be on social media. And I'm like, really? I've been trying to ban my child from this, and now I have to be on it.
Oh my gosh. I listened to a speaker about how social media really should be limited for so many reasons. But he's talking about don't do social media. And I'm like, but that is the new magazine. That's the new commercials. People want to find you. They don't know how to find you. And so, TikTok, Instagram, Facebook is a great way to find more information about what our clinic looks like, what our packages look like. You can meet the providers and then book an appointment, come in and talk to us. Happy to do it.
Well, this has been such a pleasure. Thank you. And I really appreciate this newfound kind of collaboration, and I think the future for both of us is bright.
I agree. I am so grateful for you, and I am grateful for your mentorship of, understanding and educating our community of how cool it can be. That's what Beyond Health has done.
Well,
thank you.
All
Thank
right,
you so
thanks.
much.